I don't know if I really believe in the term pre-diabetes, because you either have it or you don't have it. And I think sometimes the pre-diabetes word is a way for healthcare practitioners to say, oh, you're kind of on your way, but you're just barely there. You might want to make some changes. But in my opinion, pre-diabetes means, like borderline diabetes means borderline control. So can you expand on pre-diabetes and what's going to happen in the future when you do get a diagnosis like that, and just kind of expand on just what I expressed just a little bit ago?
Yeah, I will. I am going to ask first, if you've used the word a few times, and it is a sensitive word with me, by what you mean by control. How do you define that? I think often when people talk about control with diabetes, they think they're controlling the things that nobody wants with diabetes, which is either a low blood sugar or complications down the road. And yes, science and research studies showed that when people spend more time in optimal range, that there are less instances of the complications, but there is absolutely no certainty in that belief. And often people with diabetes are living behind this illusion of certainty that if they do this, that they will not get this. And I approach it differently. I approach it, what is important to you, what quality of life is important to you. If you want to extinguish your resources on getting that optimal range at a lot of costs of your relationships or your time or your cognitive energy I have a lot of friends who will do a lot of microdosing, and they are just looking to be in that optimal range at all costs. And what I notice often is there's a cost no matter what with what you're doing with your cognitive energy. So with control, I tend not to use that word. I tend to say it's important for you to spend time in target. That's how you define health. That's what works for you.